Dr. Richard Herbold. Today we're going to be talking about knee pain. We're going to be talking about chronic knee pain, not an acute injury that just happened. We're going to be talking about a chronic condition that's been maintaining itself for at least 12 weeks. That's by definition what chronic knee pain is about. And the reason we're going to qualify that chronic knee pain is we're going to talk a little bit about the reason why it occurs. We're going to talk a little bit about the connection between spinal mechanics and the nerve roots and the knee itself. So my practice is based on a neurological, nutritional, neuroendocrine immune approach to health. So the complications of how biochemistry and structure fit together is really what my clinic is all about. I tend to be the person who solves the problems of chronic problems and looking at health from a different direction. Today what I'd like to share with you is the importance of how oftentimes structural issues over a long period of time, along with biochemical issues, start to erode joints such as the knee. And the knee obviously is a major postural joint. The hip joint is a ball and socket joint, so it has a very firm attachment to the structure, and the knee, as the shoulder, is not quite as substantial. So what happens is neurologically, I drew out part of the lumbosacral plexus over here, which means the low back, and below it in the pelvis, the nerves that come out. Most people are familiar with sciatica, and sciatica is a nerve irritation that comes out of low back nerves, the lumbar spine and the sacral plexus itself. And I'm going to talk a little bit about the connection to muscles. So let's get started. And basically we're looking at a picture over here at the very bottom of your mid-back, which is T12, all the way down to the bottom of your spine at S4. So we have contributions that are not that important that I've listed over here of the nerves that come out. And more importantly, what we're going to really talk about is the contributions of L2, 3, and 4 to begin with. And the femoral and obturator nerve come out between those areas, and they give rise to different muscles. What we're really going to talk about right now are the contributions to the big beefy muscle in the front of the thigh called the quadriceps, quad meaning 4. So in particular, the vastus medialis and the vastus lateralis are part of those 4 muscles. So that's the control unit of the stability, or part thereof. There are a lot of muscles that contribute to this for stability from the inside and the outside of the knee. So as you can imagine, if you lose some of that stability, oftentimes you'll create what's called a tracking disorder. And a tracking disorder is when the patella, which is the bone on the top of the knee that kind of floats, gets pulled one way or another. So you can imagine the amount of friction and tension from all your body weight sitting on top of this joint that doesn't sit square under the postural system. So the other muscle, nerve that we're going to talk about, connected to a muscle, and that muscle is called the Popliteus muscle. And the Popliteus muscle is very involved with the knee so it doesn't hyperextend. It also is involved with unlocking the knee every time you take a step. So the portion of the sciatic nerve, which is L4, L5, S1, S2, and sometimes S3, we put a little question mark on that picture, is the sciatic nerve gives rise to the common peroneal and the tibial nerve. And all these nerves have a multitude of different muscles that they connect to. So for instance, let's say, hypothetically, that at L5, the nerve root innervation, particularly to that Popliteus muscle, is stenotic. And stenosis is by nature of the description a narrowing of the spinal canal. If it's stenotic or osteoarthritic, meaning it has spurs and inflammation, what happens is the nerve root information that gets to the muscle is no longer a clear picture. So that knee stability, as you can imagine, is greatly, greatly dependent on the integrity of the low back itself. So the approach that I take for chronic knee pain is not only evaluating this area neurologically as a credentialed neurologist, but also is to look at it orthopedically and also look at it muscularly. One of the tools that I use in my office is called Genex, and Genex is a muscular technique that's very different from most techniques that most people are familiar with that physical therapists and other chiropractors use as tools. Genex is not a chiropractic technique, but it is a muscular technique that looks at how muscles fire. So if muscles have lousy innervation, starting from the spine, and have poor muscular coordination, either spinally or for some other reason, including postural adaptation. So what I mean by that is if you're walking around like an old pirate for 10, 15, 20 years, eventually your brain sees that limp as normal, and it redefines the position of your knee. What we can actually do with Genex is structurally help to redefine how the knee sits under your postural system, and then with the help and the assistance of other therapies that we use in the office that are very, very progressive. We use a class 4 laser, and a class 4 laser is FDA approved, and it's kind of like a Star Wars tool as far as dealing with inflammation. So from swelling and edema and inflammation, we can take that down very quickly with this class 4 laser. It's a 25-watt laser. And we also use a variety of other tools to help to reduce the inflammation and create the tissue healing and support quickly. So if you fit into this qualification of chronic knee pain, what we need to do is have you come into the office so we can examine the knee, and we need to take the case history to see whether or not you fit into that type of a program that we're talking about over here. So my commitment to my chronic knee pain patients is that we give you 2 free visits after the examination to see whether or not the type of therapy we're talking about will in fact help to turn around your knee pain. So if this is intriguing, if this is something that you think might fit into your world, please call us at 518-371-6431 and make sure that you make that appointment. And Suzanne will tell you a little bit more about the dynamics of making the appointment or the front desk. And I look forward to meeting you. So thank you for your time, and look forward to more informational pieces as we move along in my new website. So I'm pleased to talk to you today, and I look forward to seeing you. Have a great one.